So this is the ECG of a 65-year-old male patient who presented to the hospital with the complaint of chest pain, perspiration, and vomiting, and all of his symptoms started suddenly. So as you can see, uh, first of all, I want to tell you that this ECG has a lot of findings. Many findings are present in the ECG, so we have to look very carefully. And also, this ECG does not look very great as this is not a book ECG; it is a real-time ECG, and we cannot always remove the artifacts from it because the ECG in the ER is performed very rapidly, and the patient may also be moving sometimes. So we cannot always prevent artifacts. Yeah. So if we look closely in the lead 2, we can see that the R waves are very close to each other. So this patient definitely has tachycardia, very easily visible. No need to uh, think much about it. Tachycardia is very easily visible here. So because tachycardia is present, it is an indication that sympathetic system is activated, and also this tachycardia is not slight tachycardia. This is a very high tachycardia. So when sympathetic system is activated, sometimes ventricular premature contractions are also visible. So if you look in the anterior leads, these are very clearly visible. This is the classical phase of ventricular premature contraction. They always look like this. So if you're able to memorize this picture, you will always be able to find ventricular premature contraction. It always looks like this. And another thing which is very important to look here is that the QRS interval, it is wide, very easily visible in lead 2 and all the leads. You can see in any other lead. So see here, the QRS interval is wide. And again in the anterior lead, if you see, the classical pattern of right bundle branch block is visible here. The RSR pattern, the small r, then small s, then a big R. RSR pattern also visible here. This is the classical pattern of right bundle branch block, the RSR pattern. Uh, Also, because this patient had a past history of ischemic heart disease and he presented a very typical presentation of myocardial infarction, we need to rule out the typical findings of myocardial infarction. Either find them or rule them out. So, if you look closely, although it is not very easily visible, but because this is the most important finding we need to look for, look here, the ST elevation, very clearly visible in this wave, although if you look throughout the ECG you will have difficulty finding it. Also this, look here, this is the PR, this is the PR, and this is the ST segment. It is clearly elevated. So, and this beside this is the ventricular premature contraction, as I just told you. This is a VPC. So in the blue, you can see that STL segments are elevated in the anterior leads. Also look here, also visible here, ST elevation. This is the PR, and this is the ST segment which is elevated. So in the anterior leads, ST segment elevation are visible. So definitely this patient has myocardial infarction, which was later proved on coronary angiography, which was performed on him, and multiple blocks were present. Also, the right bundle branch block may be sometimes associated with myocardial infarction. And given the classical presentation of the patient, we always need to rule out myocardial infarction. So this is not a very simple ECG. It is a complicated ECG because so many findings are present, and a closer look is required, especially when the patient has a classical symptoms of myocardial infarction.